Governor. It's Tim White at Channel 12. I just need a little clarity. Kim Kalunian asked you a question, the first question of the day, where she asked for the projected number of fatalities, and you referred to the red line and the blue line, and the chart that Cap TV put on the screen showed the projected number of beds. So could you just, right here, just tell us what the projected number of fatalities are, the expected, and then the higher number, just so we have it right?
Okay, so the blue line is about 2,000 deaths through the end of October. But you know what? I could probably have someone get you the precise number if you could wait, like 10 minutes. It's about 2,000 deaths, like 2,000 and change deaths through the end of October for the blue line, and it's 4,000 deaths for the red line through the end of October. But I can probably get you the precise numbers by the end of this 15 minutes.
Okay, sounds good. Thank you.
Can you get? I can. Yep.
Hi, Governor. This is Alan Gibberti from WBOB. I had a question regarding the face masks. What happens if on Monday employees show up to work and the employers have not provided either the materials or the face masks for them to wear?
Then they should call DBR, Department of Business Regulation. At this point in time, DBR has not promulgated regulations that have a particular fine or penalty. However, if DBR gets a lot of calls next week, then that's what I'm going to have to do. So there's a hotline at DBR, call. We will enforce it. We will call the employer, and as I said, if necessary, DBR. I've given DBR the.
I'm on a conference call.
And they can do a fine.
I have three data geek questions. First, the number of hospitalizations, does that include non-COVID cases?
No.
So that's above whatever would normally be in the hospital?
Correct.
And at what point does the blue line reach a level that COVID hospitalizations look like any other typical respiratory illness?
I have no idea. I got to get back to you. Say the question again, Paul.
At what point does the number of COVID hospitalizations look like some typical respiratory illness that, it wouldn't stand out in terms of the numbers?
Oh, I see. So like on any given day, how many people are in the hospital with pneumonia?
Correct.
Okay, let me call. We'll get back to you on that. I don't know.
And the last one, can you give the breakdown by 10-year age groups of the 105 people who have died?
I think that's on the Department of Health website. Do you have it right in front of you?
Not for all of the age groups, but we can get that to you. Joseph Wendelkin is on the phone and can work on that.
Thank you very much. Stay safe.
Governor, what's the situation right now on the Abbott testing and just the testing in general? This is Michelle Smith from AP. Earlier in the week, you said you were still waiting for those Abbott tests to come through. Do you have those tests? Are you waiting for more? And also, how is your reagent supply now?
We received some more tests. We had been told that we would get 15 pieces of equipment and 150 kits per. So what's that, 2,250. We've currently received about 850. So a little bit less than half of what we were told we would get. So that's that. Reagents, it depends. So that's a hard thing. Like we have all kinds of different equipment, and so for some of the equipment, like Roche has been excellent at filling our orders. So for the equipment that has Roche reagents, that's really good. The Cepheid machines that we run, we're struggling to get enough of reagents for those machines. So it's kind of it depends on the machine and the vendor. With respect to Abbott, the challenge is the federal government has said, and Abbott has strictly enforced this, that Abbott is not fulfilling any of the state's purchase orders. They're running everything through the IRR, and that, as I just explained, we're getting, small allocations relative to our needs.
In your view, is the IRR, like the way that the IRR is prioritizing filling those needs from states, do you think that they're doing it in a way that makes sense to you?
It's very hard to know how they are prioritizing it. We don't have any, insight into that really. I would say that I know of many governors who are in a similar situation to me, so I believe there just isn't enough total supply, and so we're all getting, some allocation. I don't have a feeling that some states are getting 100% of their order and we are getting the short end of the stick, if that's your question. I think there's just not enough.
Do you have a plan yet for relief for municipalities? It's Elizabeth McNamara from East Greenwich News. Do you have a plan yet for relief for municipalities?
What do you mean relief?
Well, the federal stimulus money, once it comes through, how is that going to be handled, basically?
Yeah.
And
hi, it's Brett Smiley. We've been working closely with the League of Cities and Towns, and the first and most important step is for them to track and gather information about what the impact has been in terms of direct expenditures. And so the Division of Municipal Finance, which is under the Department of Revenue, has been working closely with the League and with mayors and town managers to start reporting that information up to us so that we can have a thoughtful conversation around what the fiscal impact is to our cities and towns, both in terms of direct expenditures and other budgetary impacts similar to what we're seeing on the state side, like drop in revenue. And then we're going to work with them and explore options.
Can I interrupt for 1 second to answer Tim White's question? So the cumulative deaths for the blue line is 2,120, and the cumulative deaths, again, through October, of the red line is 4,015.
All right, Governor, I got it. Thank you.
I have a question for Dr. Alexander Scott. This is Mary McDonald from the PBN. Dr. Scott, you mentioned that 45% of the COVID-19 cases are among Latinos. Can you clarify, are those testing positive cases after testing, or are these hospitalized cases? Can you elaborate?
These are among all of our positive COVID-19 cases.
Okay. Can you break down the congregate care deaths?
Excuse me. I'm sorry, is that just the folks who have tested positive?
Yes.
Okay. Thank you.
If I could follow that question as well, then, are you anticipating a spike in cases amongst that population? Let's say you were to set up a community health center in West Elmwood or something like that. Is that on your radar screen at this point?
Yeah, expanding testing to make sure that we are getting data on all of the populations is a definite focus, and we would anticipate that if we're testing more, we will see more cases, which is what we want to do so that we can identify folks and make sure that they have the supports that they need and help really stem the transmission to new cases occurring. So we anticipate seeing more.
Doctor,
Can you break down the congregate care deaths?
Yes, that.
Yes, I can. For the unfortunate deaths that happened overall, we have 87 deaths in congregate care settings, 84 deaths in nursing homes. And the nursing homes with significant numbers of fatalities include Golden Crest with 24, Oak Hill with 18, Orchard View Manor with 20, and Oakland Grove with 5.
And all of today's 18 deaths were nursing homes, or were there other congregate care?
They were from congregate care settings, and my understanding is all were nursing homes. I will let you know if there were any other congregate care settings included in that 18.
So to be correct, is that 10 new reported deaths at Orchard View?
Yes, based on the reporting description that I had given.
And so you said that 9 of the 18 actually died yesterday. So when did the other 9 die? Is this just a delay in reporting due to test results?
Yeah, for a variety of reasons, but it's been over the last 5 to 6 days, from the 10th until now. Many of these nursing homes are extremely challenged with everything that's going on, so we're working closely to support them. We're talking to them daily, but also supporting them in providing us that information as they obtain it and as the test results come in as well.
Thank you.
In New York,
if I could ask a question about the model, the model.
In New York, they had to put out a much higher number of dead due to the change in I think the CDC had changed its guidance on who could be attributed as a COVID death, and so New York's number jumped by a significant amount earlier this week. What is happening in Rhode Island on that front, and do you anticipate a large number of previous deaths being reclassified as COVID deaths?
As of now, we are staying with the approach of COVID-associated deaths that we have described and is the public health approach to capturing them. We don't anticipate a significant jump, but know that there can be the challenges with reporting that we've shared today.
We have about a minute left.
Governor, we are hearing from farm stands and farm stands. On the models, the governor had said that the main input is effective social distancing. What are the other numbers 2 through 5 that affect the model's outcome? This is Michael Blow from Motif.
Rate of spread, what percent of people who get it go to the hospital, what's the length of stay in the hospital, what percent of people die, et cetera.
Are any of those factors within the control of the state or medical teams?
No.
No, okay.
Governor, Alex Walden from WPRO. We're hearing from garden centers and small farm stands in Rhode Island that are saying they are forced to only do basically pickup and delivery, but are competing against big box stores that basically have an upper hand in selling similar products like plants and local produce to people actually in the store. Massachusetts calls these small businesses essential, but can that policy be revisited in any way, just due to this being crucial selling months for those small businesses?
Yeah, I'm looking at it. So Janet Coit from DEM is in close contact with the businesses that you're talking about. A lot of them haven't been open. They're just starting to open now, as you say, and they have very short seasons.
Right.
And they tend to be small, and they are working with us around ways that they can do it so that they can be safe. So I hope to have something to say on that soon. But I'm sympathetic, and we're working at it.